topic is superficial and deep heating modalities with physiological effects in relation with Swedana. Introduction. Heat therapy relieves pain and stiffness by boosting local blood flow and relaxing soft tissue. Swedana includes therapeutic sweating to liquefy kapha and ama and achieve similar goals. Both use thermal energy to prepare tissue for movement and reduce discomfort. Key difference. Swedana follows classical dosha based reasoning. Physiotherapy heating flows measurable thermal physiology. This presentation compares both approaches and explores their integration for holistic patient care. Swedana definition. Swedana literally means to sweat, a classical procedure that induces therapeutic perspiration. Doshic basis, it is Ushna Guna, Sara Guna. Qualities liquefies accumulated kapha and ama, opening the shrotas. Classical reference described in Charaka Samhita and Sushruta Samhita as a Purva Karma pre-operative steps before Panchakarma procedure. Effects reduces stiffness and pain, improves blood circulation and produces feeling of lightness. Usually performed after snehana to deepen oil penetration and enhance sedimentation. Types of Swedana. There are two mainly types, Saagni Sweda and Niragni Sweda. Saagni Swedas are 13 in number. They are Sankara Sweda, Prastara Sweda, Nadi Sweda, Avagaha Sweda, Parisheka Sweda, Ashmagnaha Sweda, Jetanka Sweda, Kuti Sweda, Karsha Sweda, Bhu Sweda, Kumbhi Sweda, Kupa Sweda, Holaka Sweda. Niragni Sweda are 10 types. They are without direct fire. Vyayama, Ushna, Sadana, Guru Pravar, Kshuda, Bahupana, Bhaya, Krodha, Upanaha, Avaha, Atapa. Based on application, it is two types, Ekanga Sweda and Sarvanga Sweda. Ekanga Sweda means it is done to the specific point. Sarvanga Sweda means it is done for whole body to specify Vata dosha, kapha disorders. Raises tissue temperature into the therapeutic range roughly 40 to 45 degree Celsius to accelerate healing and ease pain. Classification. Superficial modalities and deep modalities. Hot transfer mechanism, conduction, convection, radiation and conversion. The goal of physiotherapy: prepare tissue for stretching, joint mobilization and exercise while reducing pain and muscle spasm. Superficial heating modalities, in that hot packs, paraffin wax, infrared therapy, fluid therapy comes. First one is hot packs, moist heat via conduction applied 15 to 20 minutes, wrapped in towel to prevent burns. Paraffin wax bath, conduction with low thermal conductivity, retains heat for longer duration, ideal for hands, feet. Example is rheumatoid arthritis. Infrared therapy, radiant heat with no skin contact, situated to longer surface area. Fluid therapy, connective heat combined with gentle massage and mobility. For the superficial heating modalities, the 1 to 2 centimeter depth is limited by subcutaneous fat, which act as an insulator. Deep heating modalities, in that ultrasound, shortwave diathermy, microwave diathermy are come. First one, ultrasound, converts mechanical vibration to heat, also produces non-thermal effects like cavitation and micro massage. Shortwave diathermy, electromagnetic energy converted to heat in deep tissue via capacitive or inductive methods. Microwave diathermy, less commonly used, poor penetration through fat with risk of localized hot spots. For the deep heating modalities, depth is 3 to 5 cm, reaching muscles, joints, capsule, and tendons. Safety: metals, jewelries, and implants must be removed before diathermy to avoid reflections and burns. Physiological effects: vasodilation, medicated by the axon reflex and local release of histamine like substances. Increased blood flow delivers oxygen and nutrients, which clears metabolic waste such as lactic acid. Reduced pain works via the great control mechanism, slowed pain, fiber conduction, and endoperic release. Muscle relaxation reduces gamma motor neuron activity, breaking the pain spasm pain cycle. Increased tissue extensibility, collagen fibers elongate more readily, making heat ideal before stretching. Increased metabolic rate, local tissue metabolism rises roughly 13% per 1 degree Celsius. The Van't-Hoff's principle is works. Comparison of Swedana and physiotherapy. Swedana rest or doshic holistic therapy. Physiotherapy is heating rest on biomedical evidence. Heat source for Swedana is herbal steam and medicated oils. For physiotherapy uses electrical or mechanical devices. Depth of action of Swedana produces variable whole body systemic effects. Physiotherapy targets a specific measurable depth. Evidence-based comparison: Swedana draws on classical text which limited modern trials. Physiotherapy has substantial clinical trial evidence. Practitioner comparison: Ayurvedic physicians has done based on classical references. Physiotherapy is done based on licensed therapy. Common goals: pain relief, improved circulation, and restored function. Indications: osteoarthritis reduces stiffness and improves joint range of motion before exercise. Muscle spasm relaxes hypertonic muscle and interrupts the pain spasm cycle. Chronic pain, example chronic low back ache and fibromyalgia. Joint stiffness post immobilization, stiffness applied before mobilization. Also in Ayurveda, Vata predominant disorders and Kapha disorders. Also in physiotherapy, adhesive capsulitis, pre-exercise, warm-up, and myofascial trigger points. Contraindications: acute inflammation, bleeding disorders, malignancy, impaired sensation in pregnancy. In acute inflammation, heat can worsen swelling and edema in the first 48 to 72 hours. Bleeding disorders, vasodilation release rises the risk of increased bleeding. Malignancy, the risk of promoting tumor growth via increased local blood flow. Impaired sensation, diabetic neuropathy or spinal cord injury raises the risk of unnoticed burns. In pregnancy, acute infection or fever, cardiovascular instability, DVT, and pacemakers or metal implants during diathermy increase the risk of health. Clinical integration: Swedana can be paired with exercise and manual therapy under professional supervision. Apply heat before stretching or mobilization to maximize tissue extensibility. Swedana often prescribes Basti medicated enema to enhance therapeutic penetration. Track skin response, tolerance, and vital signs throughout treatment. Guidance on hydration, rest, and home care after treatment. Evidence: systemic reviews support short term relief of low back pain, and improved mobility. Therapeutic ultrasound evidence is mixed with modest effect sized reported for many conditions. Swedana lacks of large scale randomized trials. Evidence is largely classical and observational. Growing interest in integrative medicine research to validate combined protocols with standard outcome measures. Conclusion: both Svedana and physiotherapy heating relieves pain, reduces stiffness, and restores function. Doshic and biomedical reasoning differ, but the underlying pathological effects overlap. Sustainability integrated approach, commonly both Svedana and physiotherapy, may enhance patient outcomes by bending, blending the traditional and modern care. Further collaborative research is needed to build standardized evidence-based combined protocols. References: Charaka Samhita, Sushruta Samhita, Essential Medical Physiology, Therapeutic Heat and Cold, Ashtangarudaya. For the enhancement of Svedana and physiotherapy. Thank you.